And I once again welcome everybody into this space. Thank you so much for joining us today. We have amazing presenters today. We are we have with us two very important groups, which is the Migrant Clinician Network, and we have Dr. Pamela Sa- Secada-Sayles from Peru, joining us from. She's originally from Peru. Right now, she lives in LA, and the she is the senior program manager of mental health and well-being for the Migrant Clinician Network. We also have Jessica Calderon Gomez. She's the program coordinator for mental health and well-being, and she is from Texas, originally from Mexico. And then we have the Episcopal Farmworker Ministry. And representing the Episcopal Farmworker Ministry, we have Allison Irarte. She's the program minister. And we have Father Fred Clarkson. Um, and Allison is originally from El Salvador and both of them are based in North Carolina. Father Fred is from Colombia. And I turn it over to Kathleen so that she can introduce the topic for us. And of course, I'm Elizabeth Rodriguez, and the other person jumping on is our new executive director, Kathleen Wood.
Hi, all. It's so good to be with you. Appreciate the team effort there as we begin this webinar and as you've joined us. We're meeting during BIPOC Mental Health Awareness Month, and we're doing this intentionally because Black, Indigenous, people of color oftentimes face higher barriers to mental health care. It includes costs, availability of culturally competent providers, language access. We're going to hear more about that from the folks from the organizations that are presenting, while also facing really compounding stressors like discrimination and economic precarity. So farm workers can experience these barriers and stressors even more acutely. For immigrant farm workers, migration, language barriers, and limited access to care just really compounds the physical toll of the work itself. So this month exists because BIPOC communities, of which many farm workers belong, deserve care that meets them where they are and addresses the systemic and personal stressors that influence their mental health. And as we're going to learn, and we're excited from the ministry to learn with you, that mental health support that reflects someone's language, their culture, lived experiences tends to be more effective and more trusted than approaches that don't center these things. And so we want to learn how these folks are doing that work. We've brought together these leaders who work on this from different angles. They work from a public health and program design perspective, direct community mental health work, and ministry-based preventative care. And so together, we're going to listen and learn about both the systemic challenges and what community-centered mental health care for farm workers looks like in practice. The reason that the National Farmworker Ministry is part of this conversation is that we believe the way we do ministry and the way we practice ministry is that we are with farm workers and their families. We listen and we learn, and then we organize, and we do it all over again. So we are part of this practice of listening and learning with you today, and then organizing to take action in the kinds of power that we have. So with that, excited to turn this over to Pamela and Jessica. And thank you for being with us.
Good morning, everyone. Just wait for the presentation to begin. Beautiful. Great. Thank you. Good morning, everyone. Good morning or good afternoon. Thank you all for being here with us today. My name is Pamela Secada-Sayles. As mentioned, I'm a Senior Program Manager for Mental Health and Wellbeing at Migrant Clinicians Network. Next slide, please. Before we jump into the topic in our conversation today, I just want to briefly introduce Migrant Clinicians Network, or also known as MCN. Our mission is to create practical solutions at the intersection of vulnerability, migration, and health. And our vision is a world where migration is never an impediment or a barrier to health and well-being. Our work is very practical. We work with clinicians, community health workers, community-based organizations, and other partners to really understand the different barriers people are facing and try to figure out ways that can actually help. Next slide, please. This slide gives you a sense of the different areas that MCN works in. We provide education, technical assistance. We also do research, advocacy work, worker health and safety resources, and then also support for healthcare providers, clinicians, or other people serving communities. We also have a program called Health Network. It's a bridge case management program, and you'll hear a little bit more about that later on. And really, it's really important to note that mental health and well-being are connected to almost every part of the work that we do, right? For example, we work to support clinicians, like I said, community health workers, advocates, and other workers who work with communities that are experiencing high levels of stress and trauma. And because the people are providing care and support, they can also be affected by the repeated exposure to the distress and difficulty experienced by others. Next slide, please. And there are three main questions guiding our conversation for today. What mental health challenges are common in farm worker communities? What working, social, and environmental conditions contribute to those challenges? And then what can organizations like MCN offer? So more specifically, why does community-led support make a difference? Next slide, please. And when we talk about mental health, we often talk about the symptoms, right? We talk about the anxiety, symptoms of depression, stress, and trauma. But really, if we only focus on the symptoms, we can miss what is actually happening around the person. Because the reality is that agriculture in the United States has a really long history of exploitation, exclusion, racism, and immigration-related vulnerability. And that history, unfortunately, still shapes the working conditions, the relationships of power in the working environment, and then also access to healthcare today. So when someone is feeling overwhelmed or they're exhausted, maybe they're worried, or maybe they're unable to sleep, it's important to look not just at those symptoms, but at the conditions that they're dealing with. Maybe it's worry because they're unable to cover rent or unable to buy food for the family. I'm in California, like it was mentioned, so we know about extreme heat and how hot it's been lately. And so maybe there's stress or worry because they just don't feel safe enough to ask for a break, or maybe they don't have the proper equipment or resources to protect them from the heat. There can also be work-related injuries, and there could be fear to report because of fear of retaliation. Many of you, I'm sure, have seen situations like this, and in those cases, distress, those feelings of distress, those symptoms can be completely understandable, reasonable response to unsafe, harmful, or unstable working conditions. Next slide, please. And farm worker women face additional risks, largely in a largely male-dominated industry. Women make up about 1/3 of the agricultural workforce, and many experience sexual harassment and other forms of gender-based mistreatment. And that can include unwanted touching, threatening language, or just inappropriate behavior from coworkers or supervisors or other people that are in positions of power. And if we think how hard it is to report something like that, when the person involved in the incident can also control your schedule, control your income, can control your housing conditions, and whether you can continue having a job or not. And so many of these experiences are left unreported because of the fear of losing their job or again, the fear of some kind of retaliation. And all of that can have serious effects on mental health and well-being. Next slide, please. These are some of the common mental health challenges that we see in farm worker communities. It's important to note that people may not describe what they're going through using some of these terms, right? They may say stuff, they may not say, I have anxiety or I'm depressed, but they can say things like, I can't sleep, my whole body hurts, I'm constantly worried all the time, I have no energy, or they just don't want to talk to anyone. Some people may seem irritable or constantly on alert. Others may feel quiet. They may be just numb or completely just disconnected. I'm sure we've all probably have met somebody who, when we ask them, how are things going? They just say, I'm fine. But in reality, we can clearly see physically that maybe they're not as fine as they say they are. So it's really important to not just look at the symptoms, but also see what words and what words people are using, the body language and the behavior. Next slide, please. Let's look at more closely at some of the working conditions that farm workers are facing. Low pay and financial pressure leave very little room for error. One missed day of work, one injury, or one unexpected bill, health bill, whatever, can create serious crisis. And for many other farm workers, they're supporting children, families in other countries as well. So that worried is often connected not just to like fear with your job, but also it's connected to the love and the responsibility that people have to take care of their family members, not just here in the States, but abroad as well. Piece rate pay can also create pressure to work faster, to skip breaks, to keep working through maybe some pain, working through extreme climate, extreme heat. Farm workers might also be exposed to dangerous machinery. We know that they're exposed to pesticides, repetitive injuries, again, long hours and extreme temperatures. And at the same time, many workers, thank you, many workers may feel like they have little power to speak up. So it's not just the emotional, but also if you know something is unsafe, if you know something is unsafe and you're working in your working conditions are like the ones that I had mentioned, it's really hard to be able to speak up and say anything, because that can create, and those feelings can create feelings of helplessness or just a sense of being trapped, not being able to do anything. Physical exhaustion adds another layer. When your body is depleted, it's harder to manage the stress, it's harder to connect with family or to seek support or help. And this quote on the bottom that you see in the screen here is a quote from a farm worker that MCN has worked with in the past on a different project. And it says, "There's nothing heroic about what we do. We work because we have to." And so I think that's an important reminder not to romanticize endurance, right? People should not have to sacrifice their physical or emotional health simply to try to earn a living. Thank you. And the stress does not stop when the workday ends. Family separation can also create a deep worry and a sense of grief. Legal and immigration related anxiety can also create just a constant sense of being on alert or uncertainty. Language barriers can make it harder to understand workplace information. It can make it harder to ask questions, describe what you're feeling, your symptoms, or even just to advocate for yourself. And isolation may be worse in rural locations. Transportation barriers, temporary housing, long work days, and frequent moves can all create a sense of isolation. There are also emerging issues that make these challenges even more complicated. Emergency warnings and response systems don't always reach farm worker communities quickly or clearly enough, or even in the appropriate language that they need. Climate change is increasing exposure to extreme heat, again, wildfire smoke, hurricanes, tornadoes, and all other kinds of disasters. Farm workers may also be exposed to infectious diseases, respiratory illnesses, vector-borne diseases, STIs, and other environmental hazards such as pesticide exposure. So these are all physical concerns, but they also create fear, uncertainty, grief, and chronic stress. And so when we talk about mental health, and coping skills are not just one part of the picture. People also need reliable information in the language that they need, trusted relationships, access to care, workforce protections, help with navigation, and community support. And so that brings us to our next part of MCN's presentation, where we talk about the different community-based support that is out there. If you can go back to the previous slide, please. Yes, thank you. And I'm going to hand it over to Jessica. Thanks, Jessica.
Gracias. Y yo voy a hablar en español. No sé si necesitan hacer cambios de su idioma. Y bueno, hasta ahora hemos hablado de algunos de los factores que afectan la salud mental de nuestras comunidades agrícolas. Y nosotros sabemos que ustedes saben eso. Ustedes son los que están trabajando y conocen a estas comunidades. Entonces, la pregunta es, ¿qué es lo que realmente podemos hacer? ¿Qué es lo que realmente ayuda? Y en nuestra experiencia, el apoyo funciona mucho mejor cuando es dentro de la comunidad, no únicamente cuando alguien llega a una clínica. Am, Muchas personas conocen primero a una promotora de salud, a un trabajador comunitario o a alguna organización local antes que a un profesional de la salud. Esto permite que ocurran cuatro cosas que son muy importantes y el primero es una conexión temprana. Las personas reciben o pueden recibir información antes de que se convierta en una crisis o algo más difícil de manejar. La segunda cosa que ocurre es el apoyo que se adapta a su realidad, a sus horarios de trabajo, al transporte, cuestiones del idioma, las responsabilidades familiares que a veces muchos de nosotros tenemos, ¿verdad? Y la tercera cosa que sucede es que disminuye el estigma. Muchas veces escuchamos, pero ¿cómo disminuimos el estigma sobre salud mental? Bueno, para muchas personas es más fácil hablar del estrés, del bienestar o de un agotamiento, am, sin tener que decir necesito atención de salud mental. Entonces, esa es una manera en que podemos reducir el estigma y es creando ese tipo de conversaciones, haciéndolo más normal. Y finalmente, bueno, las conexiones de confianza, las personas que ya conocen a la comunidad pueden acompañarlas y pueden facilitar el acceso a las clínicas y a otros recursos. ¿Qué estamos diciendo con todo esto? Que en otras palabras, la confianza es muchas veces el primer paso. Entonces, reconozcámoslo, nos va a ayudar también a remover algunas de las barreras que nos podemos enfrentar. Y si podemos pasar a la siguiente. Y bueno, un ejemplo muy concreto es del enfoque de la red de salud, es de que sabemos que los trabajadores agrícolas muchas veces se mueven de un lugar a otro, ya sea que se acaba la temporada de la cosecha en un lugar y se tienen que ir a otro lugar con frecuencia. Esto muchas veces puede significar que si están en un tratamiento médico, que tengan que volver a empezar, que no se lleven sus récords médicos. Yo creo que para muchos de nosotros sabemos que puede ser difícil y puede ser como que muy abrumador, muchas llamadas, cosas así. Entonces, la red de salud lo que hace es precisamente tratar de disminuir ese problema y el objetivo es mantener la comunicación con la atención, ¿verdad? Incluso cuando alguien se cambia de un estado, de un lugar a otro, de que su atención médica, sus documentos, incluso de citas y cosas así, les vayan acompañando. Entonces, el programa ofrece ayuda bilingüe, culturalmente sensible, ayuda a contactar clínicas, a hacer citas, a, como les decía, hacer transferencias de expedientes médicos y a conectar a las personas con los recursos disponibles. Sin duda, la idea principal de la red de salud es muy sencilla, que el moverse de un lugar a otro no sea una razón para interrumpir su atención médica. Y si podemos pasar a la siguiente. En este diagrama van a tener acceso a esto y lo van a poder ver con calma, pero en este diagrama resumen un poquito el proceso, ¿verdad? Todo comienza con un proveedor de salud o una promotora de salud am, que reconoce a alguien que podría estar necesitando los servicios y trata de conectarlo, de ayudarle a la persona que se está moviendo. Y siempre me gusta decir, ojo, lo importante aquí no es solo mover documentos de un lugar a otro. O sea, no, sabemos que no es tan fácil. Lo que realmente está haciendo la diferencia es reducir esas barreras, tanto del idioma o quizás es un poquito intimidante ir a un lugar nuevo. Am, Ayudan a que se sientan acompañadas las personas. Perdón, y esa continuidad marca la gran diferencia en muchos de los tratamientos. Y si podemos pasar a la siguiente. Y aquí les compartimos los QRs, donde pueden obtener más información. Como les decía, van a tener acceso a esto. Y pueden tener más información sobre MCN, sobre los diferentes recursos. Y la siguiente diapositiva, además de apoyar a trabajadores agrícolas, MCN también participa en Cultivemos, que es una red nacional que ayuda con el bienestar del agrícola y de los ganaderos. Este esfuerzo reúne organizaciones de distintos sectores para fortalecer el acceso a recursos de salud mental, apoyo entre personas, entre grupos de comunidad y servicios comunitarios. Yo diría que es un buen ejemplo de que mejorar el bienestar requiere de una colaboración entre muchas organizaciones y no solamente de un solo sistema de salud. Siguiente diapositiva, por favor. Y les compartimos este es otro recurso, es una línea directa. La persona que ven en la imagen es la persona que les va a contestar el teléfono. Ella también habla español. Y esta es una línea donde les pueden ayudar a encontrar algunos recursos. Es en colaboración con FarmAid y MCN. Y si pasamos a la siguiente diapositiva. Finalmente, les invitamos a mantenerse en contacto con nosotros, con MCN. Les compartimos los recursos gratuitos, capacitaciones virtuales que podemos tener, materiales que pueden utilizar con las comunidades con las que trabajan. Y si pasamos a la siguiente diapositiva, am, queremos cerrar recordándoles que existen recursos disponibles tanto para profesionales de la salud como personas de la comunidad. Siguiente diapositiva. Y que y en esta otra encontrarán líneas de teléfono donde se pueden contactar en caso de alguna emergencia. Sobre todo sabemos de que a veces no sabemos a dónde llamar cuando hay miedo de un suicidio o cosas así. Aquí tienen estos números de teléfono. Esperamos que no los tengan que utilizar, pero siempre es bueno saber qué hacer en este tipo de situaciones. Y más allá de los recursos específicos, esperamos que el mensaje principal que tengan de nosotros es de que la salud mental no mejora únicamente ofreciendo am, servicios ciertos servicios, perdón, mejora cuando construimos relaciones de confianza, trabajamos juntos en las comunidades y juntos tratamos de eliminar esas barreras que las personas a veces les cuesta, ¿verdad?, acceder. Entonces, otra de los recursos. Y bueno, en la siguiente, mm, les dejamos saber de que siempre nos pueden contactar, tanto con Pamela como conmigo, con MCN. Estamos aquí para hacer comunidad y ayudarnos en salud mental.
Elizabeth, we can't hear you.
Muchas gracias. Thank you so much, Pamela and Jessica. Very insightful information. And now, we turn it over to Allison.
Hola, buenas tardes. Oh, hi. Hi, everybody. My name is Allison from Episcopal Farmworker Ministry. Sorry, I didn't know which language, but I'm not in the translation side, so I'm just speaking English. So I've been with Farmworker Ministry since 2022, and so it says responding to physical, emotional, spiritual needs of the Farmworker Ministries. We are located in North Carolina, Dawn, close to Newton Grove. So we are a religious nonprofit organization that meets the basic needs of our community, and we operate on the counties of Johnston, Harnett, Wayne, Sampson, and Dublin. Our programs are created to serve the needs of our low-income communities and farm workers, temporary and local. Next. So meet the team. So I'm Allison, Minister of Programs. I was changed in the last week. And we have Lucia, the Minister of Administration, the Rev Fred Clarkson, the Executive Convener. We have the Minister of Immigration, which is Maria. She she fill out the forms for immigration. I'll be explaining it later, which programs and which service we offer. We have Veronica Chimo, Minister of Food Distribution. We do a distribution once a month. Shirley Lemon, the Ministry of Economic Development. Felipe Orozco, Minister of Maintenance, and Isaac Macias, Minister of Development. There are our phone numbers if you need to contact us. Your friend. We are always expecting calls, and we are really happy to hear your voices. Our mission and our vision. Our vision is to seek address the physical, emotional, and spiritual needs of the farm workers in the rural area, and to support opportunities to whom we serve and flourish and achieve a greater level of autonomy. We are to support and help them to grow by themselves. Our vision is to operate in overture search, restore the people to unity and God Christ, that's where we are a religious organization, and to guide the core values of inclusion, dignity, and justice. Our programs. Our rural location enables us to reach the community most in need, offering programs that foster development and independence while supporting the physical, mental health of our community members. We have sewing classes, mental health, counseling, food nutrition, H2A, transportation, and recreation. Youth recreations, English as a second language, expected mothers program, and immigration. That's the programs we offer. I'm going to be explaining a little bit of each one, if you can go ahead. We have the sewing classes. This program is start on 2023 with 12 women that start the program because they wanted to learn how to sew. There we have like some advanced and beginners. Our first group, it starts with both groups. And then as the program and the people grow, we have more population on the program. We have to separate it to advanced and beginners. So this program supports women in learning, and trade enables them to repair garments, create their own clothes, and to assist with the use of sewing machine. We assist with the sewing machines and provides necessary stuff in materials like fabric, threads, buttons, uh, and we also that encourage a woman to create their own income. Give me a second, sorry.
Anyway, I think she something called her away, but the sewing
Sorry,
program, I think she's back. She's back already.
sorry. Sorry, didn't expect that phone call over there. Yes. So this program help us to encourage the woman to be independent, create their own projects, and it also gives us like a lot of it. Most of the women sells like there it is like a therapy because they can be themselves, talk with other women, and socialize during this group. It's like a safe time for them to share their stuff, what they're going on. So most of them they tell it's my therapy. Okay, next. Mental health counseling. We have actually sessions for mental health. We offer them for local farm workers and H2A. So we have two counselors, and we've been able to provide therapy in their own language to people in crisis who need it, supporting those who lack the resource to pay for sessions with a counselor or doctor by providing free services. So we have to do a lot of promoting for this program, especially because normally people they said, I'm not crazy, but that's not why you need mental health counseling. It's just to help you get through the crisis, have someone to talk and be yourself and talk all everybody to show them that you're not alone. We are there for help you. Thanks. Food distribution. This is one of the biggest programs we have. The food distribution we offer once a month. We wish to give it more, but we don't have enough people to cover all that. But we do it once a month. So these programs aims to seize the burden of families' budgets by providing healthy food and ensuring families to have access to a complete meal that includes grains, fiber, and proteins at least once a month. Sagrada, yeah, that's fine. That's fine. We have the H2A transportation and recreation because we came to a point that mental health is not just counseling, it's also preventing. So we offer these services to the H2A mostly because as immigrants or coming from immigrant families, we understand how hard it is to live in a foreign country and the challenge one faces upon arrival. Or temporary agriculture workers come to this country to work in the fields as their visa specifically. And they work during hot summers. They most of the times they don't rest well, and that's all their week. So we try to at least on weekends when they have a free time, this recreation center is open to them so they can come whenever they want. so they can have a time to socialize with us, with their workers, with other camps. So we have like a tennis table or ping pong. We have football. We have the soccer field. We have a basketball area, so they can recreate themselves, have a good time. We also offer them snacks during that time and some sport drinks, water to they have a good time. They also have like music, they do karaoke, so they have like a lot of time so they can combat against the isolation they live weekly. La bueno, anyway, la rutina, the routine of every week so they can have a little time for them to recreate, have a little time for themselves and socialize with others. Youth recreation. This is mostly for our local farm workers who have their families in here. We offer their children's these programs for after school activities or on the summer where they only stay at home. So they have a place where they can interact with other children, also creating new skills like creativity, emotional intelligence, patience, communication. So we add these programs for school age children so they can like encourage also physical activities. We have also sports, like we also offer them the recreation center to the children's, like the soccer field and the basketball field for those that are interested in sports, so they can also have their space. We have also offer English as a second language. We know the importance that is to speak English in this country. And this project is supported in the strengthening of the education of the immigrant families through the Islands Alliance with Samson Community College. And this is offered to women and men over 18. We are like, this is out of school age, so they can learn and they can overcome the barrier language. So we have been offering this program for over 10 years. And at least the families that have come in this program, they are saying that it helps them at least to learn the numbers or little stuff like grocery names and stuff like that. So it helps them to learn a little of the language over here so they can defend themselves in the better language. Expected Mothers, this is a new program we created last year where we also promote to the women expected mothers to come to our classes when we have a midwife retire. So she gives them like emergency, like what they do in emergency, the importance of nutrition during the pregnancy stage, the emergency aid, like what to do in case you enter in labor. So this is more like a educational program we have. Immigration program. So this has been our longest running program through which we have helped thousands of families. We continue to use it to help people renew their immigration documents before they expire and encourage those who met the requirements for citizenship to complete the naturalization process. So we offer renews from DACA residency and also the application for citizenship, and also we have a immigration lawyer in here. We provide them the office so she can have like, so people that need a lawyer for any other cases can have access to a closer closer to look for an immigration lawyer. So participation and support, we always looking for volunteers. All we do is like it comes with a lot of job and we are always happy to be here for the people, but we also encourage people that likes our labor to become a volunteer and form a part of our family over here because we saw our volunteers, our community people as family. And if anyone is interested, they can contact us by email or phone number that is listed over there. And also, we welcome donations, food donations, clothing, financially, because we try to offer most of our services to our people in low, to low prices or even free so they can have a support. This is how we support our people. So we so when we talk about how the ministry meets the needs of the farm workers in physical is because we provide them then mostly like the basic needs like alimentation and clothing. We also emotionally we do the recreation centers and the recreation activities for youth and adults. For them, we try to also covering during the crisis, but also to prevent, because we think the important thing is to prevent. And by spiritually, everyone's welcome here. We don't go by religion, even that we are Episcopalian, everybody, every religion, every race, everybody is welcome here. Call to actions. Our programs enable us to empathize and build a bond of trust with our community where people feel they have a family and safe, having a place that offers them the opportunity to grow, develop their skills, as well as to share stories without fear among peers in the setting where we all belong. Okay.
Thank you, Allison. I think Father Fred, you wanted to say something as
Yeah,
well.
just briefly, we take a holistic approach pretty much to what we do, and that includes how we're run. So we're run by a committee. That's why I'm a convener or executive minister. And we just use the term executive because unfortunately the secular world wants a signature that says executive next to it. But we do operate really as a, collectively that we make decisions, and the people who decide how things are run are the people who actually do the work. And I think that's of importance. So we are a ministry in that sense. And obviously when it comes to mental health, it's a holistic approach. You have to deal with the whole person, and we operate that way as a ministry as well.
Thank you all. We will begin this question and answer session with some of the questions that you've put in that question and answer segment in the Zoom function. And Jessica, you've got a question that you'd like to respond to. Can you start us off with this conversation?
Yes. So the question is, can you talk a little bit more about how to break the stigma? Well, one of the ways that MCN likes to do it is we have comics book. And for example, now we have one in YouTube that is divided by chapters. So for community healthcare workers or anyone in the community that might be coming across to those comics book, they might find a topic that is like, oh, this is what I'm feeling. And it's like, oh, okay, this is a story. Maybe it's feeling like my story because we do it with that intention. We actually ask the community for feedback when we're doing this type of work. Um, we can share, for example, the link, but you can find them. They're free on YouTube. Um, Either print out or and you can also download it from the website. But the intention is like if we start like having this type of topics around the community, it's gonna create a little bit more of a easy, open conversation. And I don't know if Pam, do you want to add something else to this one?
Yeah, yeah, and I think in addition to having, our culturally and linguistically responsive educational materials, like Jessica was mentioning, our comic books, it's also really important to use language that doesn't have a stigma. So, for example, one of the projects that we currently are doing right now in Texas is related to mental health and diabetes prevention. And instead of using the term mental health, we used well-being instead, right? We used bienestar, which is a little bit less stigmatizing, I guess. And that actually we received feedback from community members and the community health workers that we worked with that really liked that approach. Just to try to use different types of words to convey the same message, but maybe it's not as stigmatizing. But and also, like Jessica says, continuing on to talk, continuing the conversation, continuing to share information, like our resources. And I will put the link to our resources in the chat for everyone if they're interested in.
I think from our perspective, one thing we do is we set the example. Leaders, can seek mental health assistance. And also the other thing is religious language is also important. We have a responsibilities to steward every part of ourselves, and we're not disintegrated. We are integrated. That includes our mind, our body. And we always say there's no difference between your mental health and your physical health. If you take care of your body, you have to take care of your mind because it's what God gave you. And there's nothing wrong with that. You're being a good faithful person when you do that. And that's something we emphasize always. Don't worry, that's what we're called to do, to take care of ourselves, because our incarnate state is a gift from God.
And I think that this is a great question, because we do know that, like Allison said, right, that people say, "Pues I'm not crazy. I don't need mental health," right? But um, it's coming to them, it's reaching them in their own terms. And I think the Episcopal Farmworker Ministry, you gave great examples of how you reach out to them through different activities and connect with their culture. And that is also very important when dealing with mental health, creating that trust environment where they know that they can come to you and that they're not going to that they're going to be validated, right? And that they're going to be heard, and that someone is going to treat them with dignity and respect and hear them out. And that's so important, especially when you're dealing with people in crisis who are in a mental health crisis. I think that that's the most critical thing. And it's important that when you're dealing with someone who's in a mental health crisis, that not only do you connect them to services, but accompany them, be there with them, because it's important to not leave these people alone, especially if they're demonstrating severe crisis mode where they might hurt themselves or hurt someone else.
Okay. We have time for one more question. Questions have been answered in the Q&A section of Zoom if you haven't had a chance to see that. Just with the time we have left, I'm going to kind of ask the presenters, is there anything else you would like to expand on from the answers that you gave in the chat, or anything that you've shared today that just helps us learn about well-being in farm worker communities?
This is Pam. I'm unable to chat with the webinar participants, but maybe we can just share that after the webinar, the link to our website where all of our educational resources and materials are stored.
Great. Sorry about that, but we'll make sure that you all have a link to those resources. If you now are seeing the screen, these are QR codes. By pointing your camera at them, it will take you to the websites of the organizations that have hosted this webinar. So National Farmworker Ministry, Migrant Clinicians Network, and the Episcopal Farmworker Ministry. So we'll give you a second to follow those QR codes. As we say, thank you for showing up in this space to listen and to learn with these people. Thank you to our panelists, not just for your time today, but for the work and the ways that you work. What we've heard is that you have been very intentional in the practices that you bring to bear, and with the people who you're in relationship with. And we are very grateful to that. And now that we know, we have a responsibility to act. And that responsibility both means showing up with our resources, like folks have mentioned, taking care of the person as they experience these conditions, and also changing the conditions, the systemic conditions that press upon farm workers. So we encourage you to stay in touch with the panelists and their organizations and us at National Farmworker Ministry as we continue to organize, which begins by listening and learning. And we are so grateful to do that with you today. If you have the resources, thank you for sharing your resources with the National Farmworker Ministry and the organizations on this webinar. That goes a long way to providing the services that are available to farm workers in this country. We encourage you to visit the websites of the organizations here, and give of your gifts as well as your financial resources to support their work, both now and in the future. Thank you so very much. We look forward to continuing to listen and learn with you. Our next webinar, hosted by the National Farmworker Ministry, will be on October 14th. We're going to be moving to noon on the East Coast, 9 a.m. on the West Coast, so that we can share a meal together and reflect on the food and those folks who bring and the folks that bring it to our table as we celebrate World Food Day. Thank you to the staff of National Farmworker Ministry who is behind the scenes, Debbie Lee Flores and Isabella Allegra. They have made the tech possible, and we appreciate their talents and skills in this space. Thank you to all of you for being here. We appreciate you, and we look forward to being in this space and organizing with you. Take good care.